Big Pharma? Is it saving lives or is it killing for profit? Hi, I'm Katrina Walsh. I am the Food Phoenix. I'm a former consultant pediatrician and now I'm a nutrition and lifestyle coach. And I wanted to chat to you a little bit about that today because that's the topic of my most recent blog article. I wanted to really explore how the way that we really save lives in medicine is much more to do with using natural approaches to health than it is to using big pharma. Whenever I was working as a paediatrician in Northern Ireland for like a decade and a half, there were a lot of children and babies whose life we saved as a team. And I just wanted to discuss what allowed us to do that and how it's not necessarily all to do with the pharmaceutical model that I was trained was the most powerful thing. So when we want to save lives in healthcare in the acute situation, which is basically pretty much what pediatrics and neonates is, really excels at doing. The tools that we use are actually all natural. Now bear with me and I'll explain what I mean. So we have resuscitation protocols and they're called advanced life supports. So for pediatrics, every 4 years I had to retrain and recertify in advanced pediatric life support, and in neonates it was neonatal life support. And you can find these advanced life support algorithms online. It's not hard. You can read through them all as well. Essentially with the advanced life support, the things that we really focus on, there's a mnemonic. It goes A, B, C, D, E, F, G. So where A stands for airway and oxygen, B stands for breathing, and that includes ventilator support. So that's your life support machines, but also all sorts of other sort of mechanical, I suppose, breathing supports, like things that you may have heard of, like CPAP or BiPAP, or maybe you haven't heard of them. And then C stands for circulation, and D stands for disability, and E stands for exposure, and D, E, F, G stands for don't ever forget glucose. So basically what happens in a hospital setting whenever you're working in real life with very sick kids who come in extremely unwell and who would clearly, their lives are at risk if we don't take action. So essentially the tools that we use, what we do immediately is we make sure that they are breathing okay, and we give them oxygen. It doesn't really matter what they're coming in with. That is always the first thing that we do, is to assess their airway and their breathing, make sure they're breathing okay, give them oxygen. And then the next thing that we tend to do is usually try to get an IV cannula in, get an IV line in to get some fluids in. I kind of wanted to discuss just for a minute what would happen if hospitals got rid of all of the natural supports that they use, all of the all the nutrients, the oxygen, all the other things. So what you would have to do is eliminate oxygen, and that would that'd be pretty dismal. You would also have to really get rid of ventilator support, because that is just basically glorified mouth to mouth, but done with a machine, and done with oxygen levels that you can control. You wouldn't be able to use IV fluids at all, and we use IV fluids a lot. Like, we give large volumes of IV fluids very quickly in patients who come in shocked, medically shocked. And the fluids that we use, they're all natural fluids. And whenever I was starting out my training as a junior house officer, before I went into pediatrics, when I was working in adult medicine, they were quite keen for us to use something called colloid. So the colloid is actually a pharmaceutical grade synthetic thing that we use or that we used to use in medicine, and it was supposed to be better than natural ones, but what we found in clinical trials was that people who received the IV colloid did worse. They died at higher rates than people who received just the normal saline, and normal saline is just salt water. Other fluids and other things that we give are also IV dextrose, which is glucose, which is basically sugar. We also give some salts, and those would be particularly things like calcium salts and magnesium salts. In fact, we actually give Epsom salts a lot in hospitals. It's just that it's not called Epsom salts, it's magnesium sulfate. We give Epsom salts if people have funny arrhythmias and very low calcium levels, and we also give it to people if they we also give it to pregnant women in preeclampsia where their blood pressures are extraordinarily high, and that's a danger to them and their unborn babies. We also give IV Epsom salts to very unwell asthmatics who are really struggling to breathe. Sometimes even give Epsom salts nebulized to sick asthmatic children as well. So there's a lot of use for those nutrients in acute medicine, and they really save lives. Something else that we give a lot to patients is blood products, and that's anything from packed red cells, which is just blood, to platelets, to fresh frozen plasma, to even albumin and other blood products. So that's the C, is the circulation, that's giving those nutrients to help keep your patients alive. But we use other nutrients as well, and we, if you have somebody, and this happens quite a lot in pediatrics. If you have kids with extremely high heart rates, quite often they have something called supraventricular tachycardia, and it can be life-threatening. Kids can come in very shocked, and the treatment for that is another nutrient. It's called adenosine. Where, in a lot of other cases, if you have somebody who comes in, say, with a paracetamol overdose, after you give people something like activated charcoal, you might give them another nutrient called N-acetylcysteine, which is an amino acid, and it helps with your detoxification. If you have people who, if you have alcoholics or people with prolonged, very poor nutrient intake, or they've been losing their nutrients through a lot of vomiting and diarrhea for a prolonged period of time, you can also give something called Tabernex number 1 and number 2, and these are just IV vitamins like B vitamins and vitamin C. And these also help to save lives, and also brain health as well. They stop you from, or they can reduce your risk of developing very serious brain disorders. And then other natural things that we use in medicine are the hormones, and these are really important for keeping people alive. So the ones that you probably would be aware of would be steroids. So there are a lot of indications where people have inflammation, and steroids can be life-saving in certain situations, obviously. Insulin is another very important hormone that again saves lives. If you're a type 1 diabetic, but also in some other circumstances, like if you've got an extremely high blood potassium level, giving IV insulin and IV dextrose can save your life as well. Thyroid hormone is another commonly prescribed life-saving medicine, but again, it's another hormone, so it's something that's natural. When patients come in very sick, very stressed, like if they have sepsis or another cause for medical shock, we will often need to start them on hormones and neurotransmitters like dopamine, adrenaline, which is called epinephrine in America, or norepinephrine, noradrenaline. And these can really save lives. They're a really important part of life support. If we were to get rid of the natural modalities in modern medicine, we would actually have to clear out intensive care units, because pretty much practically all of the interventions that you get in intensive care, not entirely all of them, but a lot of them use natural medicine. So it's it's the oxygen, it's the ventilation, it's the IV fluids, it's the inotropic support, which is basically those hormones that I just discussed, the dopamine, norepinephrine and epinephrine. It's getting rid of the insulin, getting rid of the steroids, all of those things. And even parenteral nutrition, so that's where you get your nutrition IV in through a drip in your arm. So you get, like, as well as your salts, they'll give you your vitamins and your minerals and your amino acids and your fats if you're unable to eat. Even the use of nasogastric tube feeds, and that's where they put a tube in through your nose and down into your stomach to help you to get some nutrition in that way whenever you're not well enough to feed yourself. Even that, we would have to get rid of that as well if we were to get rid of all the natural treatments out of modern medicine, and you wouldn't be left with much. You know, that you might be able to argue that you would be left with some antibiotics, but even things like penicillin, that's completely derived from a fungus, and the other antibiotics that we have now are largely derived from antimicrobial agents produced in nature by fungi or by bacteria, or sometimes by plants. Now, drug companies have modified some of these, allegedly to make them more potent, but it's probably largely more to do with making them more patentable as well. And you have some of the antibiotics that they use, when they've been modified from the natural ones, they've actually become much more toxic. And the fluoroquinolones are an example of this, which a natural plant antimicrobial was taken and modified. Now, it certainly does kill microbes, but the side effects, as a lot of you already know, are pretty awful. They're pretty toxic. And they're not something that you want. Whenever I worked in neonates, I was also always really frustrated by the lack of medications that we were able to prescribe for babies. There are really only a handful, and those were things like morphine, which is essentially opium, so that's from a poppy, that's natural anyway. There were some muscle relaxants as well that you could use when you needed to intubate babies. Ibuprofen and indomethacin are sometimes used as well clinically, but they do have side effects and they're a bit risky, so you only use them whenever you need to. Even steroids are used sparingly in neonates because they can have some long-term effects on your neurological development. But again, steroids, they're still natural hormones that are present in the human body. Most of the treatments in neonates are still natural treatments, so a lot of it really revolves around the resuscitation that I mentioned before. Resuscitation, that's looking after the airway, breathing and ventilation, and circulation with IV fluids again, fluid boluses, blood products, and we use those a lot. We use a lot of packed red blood cells and even platelets in neonates. And also using parenteral nutrition, that's getting your nutrients through the drip, nasal tube feeds or oral tube feeds in neonates, where you get the milk's delivered through a tube, gastric tube, that ends up in the stomach. But those are really some of the most vital ways that you can save lives in neonates. In neonates, they also sometimes use some of the potent hormones that I mentioned as well, like adrenaline and noradrenaline and dopamine. Other things that they sometimes use in neonates are something called inhaled nitric oxide. Now, nitric oxide is one of the most potent vasodilators that we can use. Nitric oxide is something that we make inside our own bodies. It's made by our blood vessels, and it causes our blood vessels to dilate and open up and allow more blood flow through. And it's much more powerful than a lot of the pharmaceutical ones. If you don't have access to inhaled nitric oxide, you can use Viagra IV with babies, because it also opens up blood vessels. Therapeutic cooling is used for something called hypoxic ischemic injury, which in layman terms would be where your brain is starved of oxygen for prolonged periods of time. So obviously that can result in severe learning disabilities, physical disabilities, and even death. So it's something that we want to minimize as much as we can, and really therapeutic cooling is one of the most important things that we can do. Therapeutic cooling, it is what it says in the tin. You cool down the baby's heads or their entire bodies, and this helps brain cells to recover. So now whenever I look back on my neonatal experiences, it occurs to me that these were the right approaches. It's better for the babies. It's important that babies aren't exposed to a lot of medications, because very young babies, they've got reduced capacity to eliminate them, and also even for their cells to be able to cope with the disruption to their function. Looking back on it, we weren't hampered in neonates by not being able to prescribe medications. It actually made it so much more important that we looked after them appropriately using the most natural and effective care that's available, and didn't get distracted by all the shiny objects and all the drugs. So I hope that's given you some food for thought, especially when it comes to how you think about the pharmaceutical industry and how efficacious it really is, especially when it comes to how you think about how powerful drugs are compared with natural solutions, so compared with nutrients and other things that really support your body at a cellular level. So these are things that I touched on very slightly in my blog post, which is just called Big Pharma, Saving Lives or Killing for Profit, and you can find it over on thefoodphoenix.co.uk. But I wanted to go into them in a little bit more detail here. Okay, hope you're having a good day. That's all from me.